Hello, everybody, and thanks again for joining me here today. Before we begin, I would like to offer a massive congratulations to all Yukoners. As of today, we have officially have the first Canadian university north of 60. Yukon University is open, and I'm very proud to see the hard work and dedication come to fruition. This transition has been in the work for quite some time. I appreciate all of the work that our Minister of Education, Tracy McPhee, has invested in making this dream a reality. It has not been without hurdles, but today we can celebrate Yukon University officially. Congratulations to the dedicated team formerly at Yukon College who have been driving this plan forward. You knew where you want it to go, and you have reached your goal. Having a university in Yukon creates so many opportunities for Yukoners. Now Yukon students can take college courses or university courses without having to leave the territory. Yukoners should be very proud to have a university here in our territory. We will continue to expect great things from the university team. And on the topic of education, I would also like to announce new funding resource for Yukon families with school-aged children. We recognize that supporting your education, your children's education at home is extremely difficult. Add to the mental and physical challenges of the global pandemic and major challenges to your routines, like working at home, for example. This is in no way an easy task, especially if you are experiencing financial hardships like so many Yukoners are. We appreciate that there are additional costs to supporting home learning. To offset these costs and to support families in need, we are offering families a one-time payment of $250 for each Yukon student currently registered in the K-12 school system. We recognize that this has been an adjustment and change in routines that create difficult challenges for families. On top of your own work life and managing household responsibilities and commitments, you're now challenged with supporting your children's learning more than you ever have. This includes coordinating with teachers, exchanging materials, being a cheerleader for your children as they learn from home, being an educator, more so than in normal situations. Students and families have different circumstances and best understand what their needs are in addressing these challenges. That is why we are providing this funding directly to families so that they can determine how to use this support to offset the challenges that they are facing. Starting today, families can apply through Sport Yukon to access this funding. Sport Yukon will issue this one-time $250 per student support on behalf of the Department of Education. Applications will also be sent directly to families through the schools. People can also call Sport Yukon directly for more information, but know that these applications will be sent directly to your families through the school system. As I have said, supporting children's learning at home is a challenge. Our government wants to make sure that we support Yukoners in as many ways as possible. This funding will help offset some of the financial costs associated with home learning, which is another small way in which we can help Yukoners during these difficult times. Last time I spoke with Yukoners was to announce our path forward plan for lifting restrictions. I have some important updates to share now on how Phase 1 is moving ahead. As of today, guidelines will be released to businesses who provide personal services, such as hair salons, tattoo artists, and estheticians. We are asking businesses to develop an operational plan and submit it for approval through the yukon.ca website. The team will review and approve the plans submitted and are committed to replying to businesses within 48 hours. At the same time as the guidelines are being produced, we will work to amend the closure orders so that personal service businesses with approved operation plans can open. We are also amending the closure orders for restaurants. Guidelines will be shared with restaurant owners shortly so that they can also work on their operational plans. We hope to have those guidelines up in the next coming days. We would like to be very clear that while we are asking all businesses to have operational plans, We do not need approval of all of these plans. The team at Public Health officials only need to approve operational plans for businesses that were mandated to close. Other businesses can continue to operate following the safety guidelines that we are asking for you to have a plan ready to share if asked. Businesses have until May the 29th to develop these plans, and they could also use the templates that are being available on yukon.ca. The plans are not intended to burden businesses or business owners or organizations. They are intended to help guide operations to keep people safe and to make it possible to continue moving on our pathway forward. As we said on Friday, the path forward is definitely a staged approach. As of Friday, new guidelines for childcare operators were issued. As of today, we will have the guidelines for personal service businesses, and later this week for restaurants. We will continue to monitor the impact of these reopening moves and how the virus is progressing in neighborhood jurisdictions. Yukoners, you are doing a fantastic job of managing through the ever-changing reality of this global pandemic, and I commend you. By diligently following the Safe 6 guidelines and respecting the orders put in place to keep each of us safe, you are doing exactly what is needed right now. I appreciate that these measures are difficult. This strange burden that this new virus has put on our communities is wearing, and it is stressful. We may be moving away from the immediate fear that was so oppressive in the early days of this virus, but we are still grappling with the impacts that it has on our daily reality, our lives from a day-to-day perspective. I know that you are looking for an end, for a signal that this strange time is over. And I know that both Dr. Hanley and I would like nothing more than to tell you that that time has come. We are not there yet, but we are getting ever closer. Every day that passes without new cases and every restriction that we lift is a positive step forward on our path to normal. I know that people are craving the certainty that dates bring with having firm dates, and we will share them as we can. Keep up the good work, stay vigilant, wash your hands, check in on your loved ones, and continuing to be there for others. Find those people in the community that are lonely. This is how we will get through these extraordinary times. Thank you, everyone, for your attention today.
Dr. Hanley.
Thank you, Premier. Merci et bon après-midi. Over the past few months, we've seen how quickly things can and have changed in our day-to-day lives, how we work remotely and online, how we visit with family via FaceTime and Skype, how our children learn as they and their teachers or coaches design new online sessions through Zoom. And while no one would have wished a pandemic on the world, it has provided us with many new opportunities to do things differently. Last Thursday, the Yukon's independent expert panel released the final report of the comprehensive review of Yukon's health and social programs and services, entitled Putting People First. We've made history on many occasions since COVID threatened Yukon. Sweeping measures, huge financial losses and commitments, momentous decisions made on short notice. The Putting People First review is also a chance to make history. The review so far appears to have the support of many involved in the field of health and social care as well as the public. If it is followed as laid out, the proposed changes will be truly transformational. To transform the health and social system into one that is people-centered, efficient, positive, outcome-focused, modern, and accessible. It's also an opportunity to show Canada how we can do better in publicly delivered health and social services. You may well have questioned why a major release should occur amidst a globe-rattling pandemic. Well, as much as possible, the show really must go on, and in some respects, this is the perfect time, a time of change and transition. Recently, Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization, said the following, which sets up the conversation about health transformation quite nicely. Like smallpox, COVID-19 is a defining challenge for public health. Like smallpox, it's a test of global solidarity. Like smallpox, COVID-19 is giving us an opportunity not only to fight a single disease, but to change the trajectory of global health and to build a healthier, safer, fairer world for everyone, to achieve universal health coverage, to achieve our dream from the establishment of the World Health Organization in the 1940s, health for all. When I met with the Comprehensive Review Panel about a year ago, I advised them on many matters of public health and population health. Naturally, I emphasized the importance of prevention, that is more than just preventative health care or screening. Prevention that takes a long view. Prevention that runs through society to support children right from the beginning of their lives. Prevention that looks broadly at government policy, whether in how we manage and respect the environment, how we must integrate high-quality data analysis into our decision-making, how we not only provide supports to people in need, but provide broader social safety nets, how health and social care should be equitable and community-based, how investment in prevention is a long-term process that needs to look further than the next election cycle, how governments should examine health in all our policies. Lastly, I asked them to shoot high and to be bold. The review is bold, and in this time of COVID, we are learning how to be bold and appropriately cautious at the same time. In the report, the panel says, crisis magnifies both heroes and gaps in care. In this crisis, we need to be innovative. We are coming across old laws or old practices that no longer fit with our present needs or that inhibit our ability to respond to emergencies. We are changing orders and policies on the fly. This is learning what we can do better. It's a time for putting people and the public's health first, balanced with keeping our society safe and well in all aspects. In a special message preceding the report, the panelists say, strengthening the ability to do better, to be a system that learns and adapts, is at the heart of many of the panel's recommendations. We've been learning a lot already about what we do well and where we need to do better. We should never let a crisis go to waste in informing us how we can do things better when normal times resume. On Friday, we announced the relaxation of the stringent measures limiting contacts outside your household. The combined household guidelines now allow you to find one other household to spend time with and not to distance from each other. Of course, the other household needs to agree. The two-household bubble includes the people where you live. It can include one person, a roommate, parents, siblings, grandparents, and children. And in this instance only, it is okay if the number of household is more than 10. All households, of course, are different. And this doesn't mean we no longer worry about COVID-19 if the disease does reappear in Yukon. Depending on how it arrives and how many people it affects, we may have to issue new restrictions. But we also know we have to look after our mental health and our connections to others, as well as our physical health. Guidelines to assist with the reopening of Yukon are being developed constantly. On Friday, of course, we had the double household guidelines and the updated child care guidelines. Today, as the Premier said, we will be sending guidelines to personal care services. And with these guidelines in place, those who offer personal care can prepare and submit their plans for approval. Once the plans are approved, these businesses will be able to open. But here's a plea for patience. These businesses have been closed now for 2 months. They have been waiting so patiently for the go-ahead to reopen and for the expected rules of reopening. But we have been hearing from them that they are being inundated, literally to the point of desperation, with calls for booking. Please give them time to prepare, arrange the childcare they need, the employees they need to rehire, the cleanup and preparation for working under restraints and conditions that a few weeks ago no one could have imagined. They will let you know, or we will work with them to let you know when they're ready for bookings to re-begin. Thanks. Restaurant guidelines for reopening will come later, and work is taking place as quickly as possible, taking into consideration all of the health protection that we need to have in place to guard against spread of COVID-19, should it reappear in the community. The 6 steps will remain in force for some time to come, although we will tweak them now and then as needed. As a result of the pandemic, we've asked Yukoners to maintain physical distancing, avoid gatherings of more than 10 people, and to stay close to home. This messaging and approach is designed to protect all individuals. I do, though, want to acknowledge that for some, staying home may not be safe. If you are not safe at home because of intimate partner violence, family violence, or sexualized violence, support is available. Victim services can work with you to explore options based on your circumstances, help you make a safety plan, and access safe shelter if you need it. To contact victim services, call 1-800-661-0408, extension 8500. Staff at the Women's Transition Home in Whitehorse, the Dawson Women's Shelter, or Help and Hope for Families in Watson Lake are also available to help and support you. And as always, if you need immediate help, please call 911. There are resources in Yukon to help you, and those agencies are ready and able to help you plan for safety and explore your options. Keeping the spread of COVID-19 under control is vital at these times, but so is helping Yukoners have the tools, knowledge, and resources to live as fully as they can while staying safe in the face of all the other hazards or risks in our everyday lives. That's all for my update. Thank you.
Thank you. We'll go now to the phone lines, and we'll begin with Jane from CBC.
Hi, my is about the businesses that are reopening and the guidelines. I know some places like hair salons are adding plexiglass barriers and taking those kinds of precautions, which is an extra expense for businesses that are already in a tight spot. Is there any relief for businesses if they have to take extra precautions and make those extra investments to reopen and be safe?
Thanks for the question, Jane. So again, as you know, we have $30,000 per month for business support for those businesses, fixed costs. We have federal relief programs as well, income wage supplements, those types of things. What we're doing is we're continuing to work with the Business Advisory Council to see what extra costs and extra needs the business community will have as we get through phase 1 and into phase 2 and subsequent phases, and we'll keep monitoring that at this time. So again, if businesses find themselves in a situation where they have extra onerous costs, I really implore you to work through the Business Advisory Council because we're relying so heavily on them and the good work that they do to keep us apprised of the costs that businesses are incurring.
Thank you. Follow-up question, Jane?
And my other question is about the double bubble. And now that there's been some loosening of restrictions around visiting, how can people stay motivated to keep following those precautions, those public health precautions, Dr. Hanley, that you've reiterated over these weeks? But now that there can be a double bubble, how do people make sure that they just limit their bubble to one other household when there's lots of people we want to see?
Yeah, it's a good question, and I think it's a matter of, again, trying to keep things in appropriate balance, and so giving a little bit of slack or relief for people who really needed. We all need social connection, and we all need a break. But at the same time, the whole next phases rest on maintaining the safe 6 that in every other situation. So it's allowing an expansion on the domestic household concept. We're really asking Yukoners to stick to that. but in all other situations to keep the safe six in mind, and also to read carefully through the guidance on on the household bubble, such as consideration of who is best in or out. So, of course, it doesn't include a long-term care resident. It would also mean that if someone is sick in a household, that they stay away from the other household. So, really using common sense. So, it's another way of asking Yukoners to, all of us to work together on this, so we can enjoy some of the loosening on restrictions, and as we're going to have in the near future, and enjoying the opportunity again to dine out, to have personal services such as a haircut or nails or tattoos. But we have to keep these things in sync with the safe six in order to be successful. We're going to relook at everything. Everything is on the table for re-examination and the potential to go back if we don't do it right.
Thank you. We'll move now to Gabrielle, Whitehorse Star.
Hi. For people who have been working from home for the last couple of months, is it up to employers now to decide that it's safe to return to the office, or is an official recommendation to stop working remotely coming in the future?
Yeah, so I think, again, this is something that's fluid, and that's probably going to be a fluid situation. I don't think that we should do too much at one time, and I think if employers have worked out ways for employees to be working at home, and that's working well, I see no hurry to change that. On the other hand, there are situations where it may be straining the employers. I think the main thing is look at the guidelines. This is another area that is not in order. So it's really what works best for the workplace, for the family, and how can safe distancing be within the workplace, be carried out, and how is that reflected in the operating plan of the business.
Yeah, I would just add to that through phase one, what we're offering is more variables that people can consider as they make their decision as to whether or not they're more comfortable working from home. Maybe you're in a situation where you have a compromised immune system. Maybe you find the balance between other COVID issues and in your home life, and just that balance is struck better by staying at home. But now through these phases of us, loosening up some of the restrictions, what we are offering to Yukoners is more options as opposed to less. And I am hearing an awful lot of anecdotal information of the new normal, about efficiencies, about how to work and how to manage the responsibilities at home and at work. So if people are getting more comfortable working home, that's great. That's a benefit to balancing your life. But exactly to the point that Dr. Hanley is making as well, we're loosening up some restrictions. We're watching and hopefully getting to a new normal every day.
Thank you. Next question, Gabrielle.
Yes, also in relation to the operational plans, I saw as the phases carry on, there's some potential for relaxing some of the safety measures that businesses have in place. Is that implemented in the operational plans, that you have a phased operational plan, or is it just one plan that will carry us all the way through to the end?
I think what you'll see is through the guidelines, a lot of the answers to the questions will be there for each of the phases as we get into them. It's not a catch-all. Of course, there'll be certain circumstances for different businesses, but for the most part, a lot of the questions will be answered in those guidelines. And as we get down into the next phases, you will see less restrictions, therefore less parameters. But again, one definitely informs the other, and as we move towards that new normal, that new pre-vaccine normal, you will see the guidelines changing, the plan changing as well. As we mentioned last week, the plan is a living, breathing document, and it will be determined how we move forward based upon the epidemiology in BC and in Alberta, and also here as to what those new guidelines are going to be.
Thank you. We'll move now to Gord at Yukon News.
No question.
Thank you. Now to Claudiane, Radio-Canada.
Peut-être juste en français, Dr. Hanley nous donnait un petit peu un aperçu de la situation à l'heure actuelle. Donc, dans votre plan de déconfinement, où on se trouve, où est-ce qu'on avance, les prochaines étapes, etc.
So the question is for Dr. Hanley. Can you give us an overview in French of where we are in the plan and what are the measures that we're going with at this point?
Oui, merci. On est dans la première étape et pour le moment, on concentre sur les services personnels. Donc, on va envoyer aujourd'hui les guides pour les services essentiels, pour faire le plan, pour soumettre le plan pour être approuvé. Et prochainement, ce sera pour un process similaire pour les restaurants. Donc, ça, c'est les deux secteurs le plus importants pour le moment qui sont sous régulation et donc sous un ordre. Donc, on va enlever, on attend d'enlever l'ordre, l'acte de loi pour les services personnels et pour les restaurants dans les prochains jours et en même temps avoir les guides pour comment faire un plan, approuver le plan et puis ils seront libres pour ouvrir. Mais c'est aussi juste, j'ai ajouté que pour les gens, pour les clients de patienter, surtout pour les services personnels, que ça va prendre du temps pour les services personnels de mettre en place toutes les préparations avant d'ouvrir.
Prochaine question, Claudiane.
Non, ça va, merci.
Merci. Excuse me. Tim, CKRW.
Good afternoon, Dr. Hanley. A question for you this afternoon. Can you get a little bit more specific on the guidelines for personal services, just so even the public kind of knows what they'll be walking into once those businesses get up and running with their plans?
You know, it's going to be, again, similar to what you may have seen published around the country. It's going to be about how to screen people, how to make sure that people who are ill do not attend. Instructions about waiting and how to space the waiting area, spacing the premises, treating this as a workplace. So, of course, limiting people on site. And then some instructions about really on the cleaning and sanitation and about how to maintain the proper cleaning and sanitation, and that's under direction from Environmental Health Services. So we will not put the guidelines. The personal care services actually asked for them to be directly sent the guidance first of all. So just to give them time to prepare. So the first step will be directly sending to the services before we put make the guidelines themselves public. But within a short while, they will also be made available so you can review them.
Next question, Tim.
Okay, this one's for the Premier. Just wanted to, following up from Friday at that time, you had said just about the budget meetings and you were waiting to hear back from the opposition parties. Well, at 5:01, your office had put out the message that those meetings wouldn't occur. Can you go through the process of, why the meetings won't be going ahead? And again, now what do you have to say to the opposition parties who are really chomping at trying to ask about COVID-19 funding? And we've seen this going on in other jurisdictions. Why not here?
So as far as the cancellation of what we were offering in May, it was the opposition who didn't want to do it. They want to talk about COVID. They don't want to talk about the budget. We offered them an opportunity to talk about the budget, every department being available. We want to talk about the lowered income tax that we've offered in the budget. We want to talk about the fact that small business tax is at 0% due to that budget. We want to talk about the small business investment tax credit that can help out companies like Air North. They refuse to take us up on that offer. When it comes to COVID, we're not done with COVID expenditures, and so that accounting will happen. It absolutely will happen. It will happen in the fall supplementary budget in a very similar manner of other emergency type of spending, like overtures on wildland fire management, for example. You wouldn't halfway through the wildfire season stop and do the accounting in the Legislative Assembly. You'd wait until the supplementary, and so again, what we're doing is we're going to have a full opportunity for the opposition to critique every dollar spent for COVID, and that will happen, and it will happen in the fall.
Thank you. Is there anyone on the line whose name has not been called?
Pour Laurent Boréal.
Marie, votre question?
Oui, mon nom est Nelly.
Oh, excusez, Lise. Avez-vous une question?
Nelly pour Laurent Boréal.
Avez-vous une question?
Oui, ma question concerne les victimes de violences dans les maisons. Je voulais savoir quels étaient les chiffres de l'augmentation de la violence familiale pendant la pandémie.
The question is about family violence. Do you have any numbers of the increase of family violence since the beginning of the pandemic?
Non, la réponse c'est que non, j'ai pas des chiffres locaux. On sait deux choses. On sait déjà que c'est un risque augmenté et on sait qu'avec toutes les mesures qu'il y a un risque qui a été vu globalement, mais on n'a pas encore les chiffres locaux pour vérifier si c'était le cas. Mais on reste quand même très concerné par le reste de cette situation. Et la deuxième, c'est malgré les chiffres, on sait malgré les chiffres que toujours le nombre des violations sont très très bas par rapport à ce qui est à la réalité. Donc ce qui est rapporté est toujours un cas, un cinquième de les cas actuels. Donc c'est peut-être tout que je peux dire pour le moment. I just to repeat in English, it was about the figures for domestic violence or sexualized violence, and I said I don't have local data, and that takes time to accumulate. But two things: one is we know that this is a risk associated with circumstances like this, so we have the concern. Despite not having actual figures, and the second is that we know that this is always underreported, vastly underreported anyway, so that we only would know about a fraction as that would actually be reported compared to the number of events that are actually happening.
Une autre question?
Non, merci, ça ira.
Merci. Thank you very much, everyone, for your time today. Thank you, Premier Silver. Thank you, Dr. Hanley. The next update will be on Friday, May 22nd at 2 p.m.